Hi friends. Friends, women have become an integral part of armed forces. The places which were considered as taboo have been captured by our women. Women in Air Force have been getting permanent commission. However, the glass ceiling was for fighter pilots and which has been broken by our brave women, and women have entered fighter pilot stream now. Navy, women can be seen in almost all departments as permanent and short service commissioned officers. If we talk about Army, now Supreme Court has ordered permanent commission for all women. And female soldiers have also started entering military in units like Provost. Women who were married earlier and are now divorced are getting permanent commission in certain branches like JAG branch, and also certain women like those who are the wives of our martyrs have been given age relaxations and they are now entering armed forces as officers. However, after this, there is no differentiation between male and female candidates, and the similar standards are followed for recruitment of female candidates also. If we talk about training, women also undergo the same harsh training what their male counterparts do, and also they give a bond to serve at all places in all conditions like any other officer. Keeping this in mind, female candidates also undergo a tough medical examination post their SSB. And friends, as we all know, the vacancies for women are as such limited in armed forces, and if they left out in the medicals, it becomes very heartbreaking. If we talk about medical examination of ladies, it is similar to male counterparts. However, there are certain different parameters when it comes to ladies. You must understand here that they are not lesser than male counterparts. However, keeping the physiological condition of the women, certain additional issues are added for the medicals. Gentlemen, there are also certain things which are related to married and unmarried women which I will tell in the later part of my video. Friends, you must understand the medicals much in advance because there are many rejections. If you know them, you can get the treatment done well in advance and you can avoid rejection once you come for medicals after your SSB. Friends, in this video, we will talk about all the tests which are specific to girls. We will also talk about the common tests which are there for boys and girls. My one request is there for the boys that please don't watch this video because there are many details about female anatomy which might be little embarrassing for you. We have already added 2 comprehensive videos on SSB medical procedure on our channel Rahagir India Students Adda. One is on normal medical examination, another is on medical rejections. Please do watch that before watching this video. Friends, in first part of my video, we will talk about certain tests which are specific to lady cadets, which includes external genitalia examination, perineum examination, check of urinary incontinence and also hernia if it is there. We'll take each one of them one by one. Friends, the detailed menstrual and gynecological history of ladies are checked in detail by a gynecologist or a lady medical officer, and complete data is thereafter compiled by her. If we talk about genital examination, first of all, external genitalia is checked by the medical officer. Herein, the examination of clitoris, anus, vaginal orifice and other parts of the vagina are done so that there is no external disease. Thereafter, the examination of perineum is carried out. Perineum is the portion between anus and vagina. Here, girls thereafter are checked for urinary incontinence. Friends, this is a condition which shows involuntary leakage of urine. It means that a person urinates when he or she doesn't want to do. This condition is a permanent rejection in medicals. Thereafter, genital prolapse of girls is checked. Friends, this is a condition wherein pelvic organs like uterus, bladder and rectum slip down from their normal anatomical position and they either protrude into the vagina or press against the wall of the vagina. Then comes the compulsory abdominal ultrasound for all women candidates. Friends, this is used to make images of abdomen, that is your belly. The black and white images show the internal structure of abdomen such as appendix, intestine, liver, gallbladder. Another ultrasound is done for pelvic for all women candidates. Gentlemen, the pelvis is a lower part of the torso. It is located between abdomen and legs. It is also compulsory for all female candidates. In this, we see the portions of vagina, uterus, pelvis via ultrasound, that is sound waves. Check of fallopian tubes and ovaries is also done using this technique. Now, coming to certain tests which are only specific to those ladies who have been married earlier and now are single or divorcee. The first one is speculum test. Friends, Speculum is a device which is used to look inside the vagina and observe the cervix. Here in this text, the normal portions of vagina, bladder, uterus and cervix are checked using speculum device. This test is not conducted for unmarried women. We are also checked regarding conditions of hernia, which occurs when an area in abdominal wall becomes thin. Now friends, I'll take on certain tests which are common with boys. However, the parameters for girls are different than those of boys. Hence, you should know them in detail. We will talk about them one by one. The first thing is height and weight. You all know that the minimum acceptable height for women candidates is 152 centimeters. However, certain relaxation is given to candidates from Gurkhas or from northeastern region or from Lakshadweep Islands. However, the minimum height should not go beyond 148 centimeters. Your height and weight chart is checked as per BMI, that is body mass index. You can see your weight which is required depending upon your height. Friends, the body mass index should be below 25. Your waist to hip ratio should be below 0.8 and your waist circumference should not be less than 80. If we talk about body mass index, if your weight is 90 kgs and your height is 1.7 meters, then your BMI is calculated 90 divided by 1.77 square, which is equivalent to approximately 28.7. The value of this BMI is, if it is less than 18.5, you are underweight, and if you are overweight, if it is above 25. Hence, a healthy person should be below 25 and 18.5. Your waist to hip ratio should be below 0.8 and your waist circumference should be less than 80 centimeters. Coming to ears, your hearing should be 610 centimeters for conversational voice and 4 whispering for each ear. Also, there should be no wax in your ears. You must get your ears cleaned before you come for medicals. Dental is fine. If you have 14 dental points, there is no cancerous growth inside your mouth and there are no more than 2 teeth loose inside your mouth. For eyes, the various standards are given on this slide. The myopia and hypermetropia are the conditions which will lead to rejection and you should be within those conditions. LASIK surgery is now permitted for eyes. However, there are certain conditions should be adhered to. Skin is generally fine. However, there are certain conditions which may lead to rejection. One of them is vitiligo, in which you can see the marks as shown in the picture. Color blindness is another condition which most of us are not aware. If you can clearly read color in this slide, then you are fine. Otherwise, you may be color blind. In army, Cope 2 condition is acceptable, in which a candidate is able to read red, green and blue colors and differentiate between them. Another common problem is of sweaty palms, and friends, this leads to rejection. You must take certain precautions and some treatments before you come for medicals. Another common problem for ladies is knock knees. Here in the second picture, if you see, the lady is having knock knees. If you are having such condition, you must do certain exercises, take some treatment like keeping a pillow between your legs while sleeping. It will help you to correct your knees. Other 2 conditions are related to your forearm. One is cubitus valgus, in which the carrying angle is more than 5 degrees and that leads to rejection. Another is cubitus varus, in which your forearm is bent towards your body, which makes a curve on the elbow and which looks like a barrel of the gun. Both these are rejection conditions. Now coming to deformity of limbs. Here, if your fingers are bent or your toes are shortened, that will lead to rejection. You must take proper treatment before coming to medicals. Piles is another condition which is also known as hemorrhoids and which can be treated by surgery or by other means. You generally get temporary rejection for piles. Friends, I have regularly spoken about surgery to correct certain deformities. Now, your fitness post-surgery is another question. If you have passed certain time, like for hernia, it should be 1 year post-laparoscopic surgery. And if you have done abdominal surgery, then the time duration is 12 weeks. However, your body should have healed properly post-surgery and there should not be any complexity after that. For all other surgeries, duration is 12 weeks after laparoscopic surgery. Gentlemen, now we come to appeal medical board. If by any condition you get any rejection, then within 42 days of your SMB, you can appeal in the appeal medical board. And even if you get rejected in appeal medical board, within 24 hours, you can go to review medical board. However, review medical board is examined by DG recruitment, and only if they find merit in your case, then they give permission to be examined by RMP. Friends, I am sure I am able to correct many misconceptions which are there regarding female medicals. I am sure now you will be able to prepare yourself well in advance and avoid rejections once you come to medical. For all other preparations for SSB and defense services, please go to our channel and watch the videos. If you like this video friends, please share it with others, and thanks for watching. Jai Hind. Thank you.